the cancer of your large bowel. It can be found anywhere in your large intestine. Hello and welcome to our YouTube channel. My name is Dr. Syed, and in this video we'll talk about a condition called bowel cancer. So bowel cancer is the cancer of your large bowel. The large bowel starts from the area which is bowel area, like your intestine. Large intestine is start from cecum, ascending colon, transverse colon, descending colon, sigmoid colon, and rectum. These all are the part of your large intestine. So in this video we are going to discuss what are the symptoms, what are the common symptoms of bowel cancer, and how you diagnose the bowel cancer, and what causes the bowel cancer, and what are the tests available for the bowel cancer, and what is the best treatment available for the bowel cancer. So if you are new to this channel, please hit the like and subscribe button and share this video to your family and friends. Thank you so much. So let's go to our topic, bowel cancer. So bowel cancer is the cancer of your large bowel. It can be found anywhere in your large intestine. As I discussed earlier, large intestine is like cecum, ascending colon, transverse colon, descending colon, sigmoid colon, and rectum, but it is more commonly seen on your left side of colon as compared to right side of colon. So left side of colon means it is more commonly seen on the sigmoid colon and the rectum as well. So that's why sometimes we call it colorectal cancer. Means it is present in the colon and the rectum as well. Okay, so what the treatment of the cancer is depend upon the area affected by the cancer. So we will discuss about the treatment as well. So let's discuss the symptoms. What are the symptoms, how you diagnose the bowel cancer? Okay, so most common symptom, or you can say the earliest symptom of the bowel cancer, is the change in your bowel habit. Change in your bowel habit means you go to the toilet more than your normal bowel habit. For example, if you go to the toilet once in a day, but after developing a change in your bowel habit can become changed and you go to the toilet like 6 or 7 times, then okay, so this is one of the common symptoms you can see in the bowel cancer. Okay, change in the bowel habit. All right, or sometimes you have a diarrhea, or you complain you are having a diarrhea, or maybe the constipation. Okay, or because your bowel habit can become change. Okay, your bowel habit has changed. Okay, so that's why you are complaining of diarrhea in one day, and after a few days you complaining of constipation. So your bowel habit has completely changed. Okay, this is the main symptoms of bowel cancer. Or you also complain of the bleeding, the parectal bleeding. So bleeding from your bottom, or bleeding in your stool. So this is also the common symptom. And also you feel like you need to go to the toilet more, or okay, even you just been to the toilet, then you said no, I need to go to the toilet again. So because your bowel habit has completely changed. So that's why this is one of the common symptom of the bowel cancer. And also other symptoms are you complain of the tummy pain, lump in your tummy. Sometimes you can feel the lump inside the tummy, or the bloating, or you are losing weight without deliberately losing weight. You are just losing weight without trying to losing weight. Okay, so these all are the symptoms of the bowel cancer. Or also you feel tired, or shortness of breath. All right, these are the common sign you can also see in the anemia, because if you are complaining of bleeding, you are bleeding parectally, so you are losing blood. So that's why when you order a blood test, you see the anemia is common, your hemoglobin level is dropped, so that's why you are, complaining of shortness of breath, or you feel tired. Okay, you that because of the anemia. Okay, these are the all commonly seen symptoms of bowel cancer. All right, so what basically happen, if you are having these type of symptoms, you need to urgently contact your doctor and discuss your all the symptoms, and see what are the symptoms you are having. Okay, then you need to discuss all the symptoms with your doctor, and just follow the advice from your doctor. Okay, so uh, sometimes also people are complaining because in majority of cases the symptom starts after the age of 50 years, or commonly seen in people who are overweight or smoking. Those people who smoke also, they have a family history of bowel cancer. Okay, because family history is also one of the risk factor of bowel cancer, or you have any like inflammatory bowel disease, because sometimes inflammatory bowel diseases like ulcerative colitis and Crohn disease is also linked with the bowel cancer. All right, or sometimes people diagnosed with a polyp or abnormal growth in their bowel in any part of the colon. So sometimes if the colon's polyps are not benign, they can lead to malignant growth in their bowel area, any area of the bowel, and that can cause the bowel cancers. Okay, so we have already discussed about the causes and the symptoms of bowel cancers, and now we are going to discuss what are the tests available for the bowel cancer. uh, Most common test, or you can say the gold standard test for bowel cancer, is colonoscopy. Colonoscopy is the test where they put the camera through your bottom, and they go directly from your bottom, like from your rectum to sigmoid colon, then from sigmoid colon to descending colon, then descending to transverse colon, then from transverse colon to the cecum, and then the ileum. All right, they check through the colonoscopy. They put the camera, and they look through the camera, and they if they find if you are already first, they clean, they advise you some precautions. You have to follow their advice before the procedure, but during the procedure, they through the camera, they look inside your colon. If, for example, if there is any abnormal growth in your colon, which is called polyp, if the polyp is present, or if there are any ulcers, if you're suffering from ulcerative colitis or Crohn disease, or if you have any proctitis, like inflammation of the bowel, so they usually look around your bowel, and they took the samples from, if this area is abnormal. Okay, they can easily take the sample during the colonoscopy, and they send the sample for histology, and they look for the diagnosis. If sometimes they remove the polyps during the procedure, this is called polypectomy, and they use different kind of apparatus to perform this kind of actions. This is one of the gold standard tests for the bowel cancer, colonoscopy. Also, we will talk about if they think you need more tests, then they will ask you to go for the CT scan if there is some abnormality in your colon, and if they think then it could be the cancer, then they ask you to go for the other tests like CT scan, MRI scan, PET test, and the blood test and genetic testing. Maybe there is a family link of the bowel cancers. Thank you so much.